Minister, I'd like to raise a deep concern that I and many others have on the success of the vaping ban in relation to children. I see evidence every single day of children in school uniforms vaping. And what we're not seeing is sanctions on those clearly breaking the law. The Environmental Health Service has stated that there has been one prosecution to date. Also, in relation to fast gas, which has been abused, it's a huge health problem. Even today, it was mentioned on the news that Crumlin Children's Hospital is seeing children with severe burns and lifelong scarring. And I was sent an email by a constituent this morning, and this is the product that's being sold. It's fast gas. It's been abused by children, by young people. This is not a product for the catering industry. This looks like it's being marketed to children. Vapes in exactly the same way. They're being marketed at children with different flavours and different tastes and different packaging. So, whilst I welcome the new legislation, it's just ink and on paper unless it's properly resourced. And I ask, what are your plans to take this far more seriously than it has been to date?
Thank you, Deputy, for your very important question. As you know, the ban for the sale of vapes to under-18s has just come into force. It's been enacted. And also we are working in relation to new legislation around, and it went out to public consultation about, packaging, and we all are very aware of how young people are being targeted. But in relation to the enforcement question which you asked, so it has just been implemented and enforcement is happening, and we will be keeping it monitored. Just briefly in relation to nitrous oxide, for the first time I have allocated 1.5 million for education and prevention measures which are evidence-based across the country, raising awareness around drugs, alcohol addiction, and this is part of the response in relation to nitrous oxide. But on Garda Síochána, we completely support them in relation to that, but also this is about education, prevention as well, parents, youth workers and communities, schools, and that they're the kind of programmes that I'm funding as Minister with responsibility for the National Drug Strategy.